All right. Well, isn't it a great day to be alive? You look at the news, you watch the news, and you might think that, hey, the world is ending, but it's not. It's a great day to be alive. You woke up on the right side of the grave today, and hey, we've got a lot to talk about, so we're going to get right into it. Today, we are going to talk about three technologies in healthcare that you want to be aware of that might sound really good, but might actually hurt you. So three different technologies that you want to be aware of. We're going to talk about the lab escape theory that is now growing in evidence and prevalence of how COVID-19 actually started. And we're also going to go through different case studies that I believe when you know these different case studies and hear these different testimonials and understand these different stories, well, that can actually help you not to make the same mistakes. So this is Dr. Nick Wilson, and you can hashtag Ask Dr. Wilson on social media and get there on Facebook, facebook.com/Ask Dr. Wilson. We're on Instagram too, so you can find us there. So let's get right into it. We're talking about technologies that can actually hurt you more than help you. Now, I want to give just maybe a little bit of a disclaimer here, because there is a news story that came out in Healthcare Weekly, and Healthcare Weekly puts out content to help you to know, hey, what's coming down the pipeline when it comes to healthcare. And so a lot of times, hey, a lot of things make good sense, and it is very helpful. But they put out an article about the technologies that all executives should be aware of and use, and they said in 2020. These are technologies that are going to be great. And looking through these technologies, I want you to decide if these are going to be great for you and your family. And one of them is talking about AI in healthcare. AI in healthcare. What does that mean? Artificial intelligence in healthcare. And if you just read what this says, it doesn't really sound that terrible, because, hey, automate reminders. So get great for helping patients take medications within a specific time frame. So you get a reminder saying take your drugs so you don't forget to do it. Okay. Identify people at high risk. So discovering those in need of medical intervention, and trigger medical staff alerts to create custom care plans. Now, listen to this. Identify people at high risk and discovering those in need of medical intervention. Why should you have alarms going off in your head right now when you hear that right there? Why should you have alarms going off in your head when you hear that? Here's the reason why alarms should be going off in your head when you hear that. Because if you have artificial intelligence that will trigger certain medical interventions, yet you don't desire those medical interventions for yourself, well, now you have this battle that you're going to have to go through, because now what happens is now this alerts your doctor. This is where this could go. This is a slippery slope. But take it another step further. How about your family? How about your kids? Now all of a sudden your child has a artificial intelligence that triggers an application that circumvents you to tell the medical community that your child is at a high risk or higher risk and in need of medical intervention. What if you choose not to have that medical intervention? Are you now medically negligent? Are you now at risk for not following the standard American medical route? And so think through the slippery slope that this could be when it comes to artificial intelligence in healthcare. I want to give you a story. I want to give you an example of this. I had a patient come in, and she has been taking morphine every 8 hours, so 90 milligrams of morphine every 8 hours for the past 25 years. 25 years. Now, what's happened, because she had a job where she was working on the assembly line and she was just a hard worker, her head was down, what happened is she ended up having neck pain. She had numbness into her shoulders, into her arms, goes into the medical doctor's office, and what do they recommend? Well, what they usually do is they do a few different tests, maybe some x-rays, maybe an MRI, and they come to the conclusion that she needs injections into the neck. And so they did injections into the neck. They also She was also told to take not just corticosteroids, but also take a drug called gabapentin. She went through the standard pain medication, anti-inflammatory, muscle relaxers. Ends up on morphine. She's been taking it every 8 hours, 90 milligrams, for the past 20 years. And you think about how her life is now affected, and here she is, she's sitting in front of me, and we're talking together. And I'm asking her, what is the main reason why you want to correct your problem? And how do you perceive that we're going to be able to help you? And she said, I don't know if you can, but I'm at my wit's end. I can't take this anymore, and I'm willing to do whatever it takes to not only correct the problem, but to get off of these medications. I think about the fact that she's gone through, let's just call it the gamut when it comes to health and healthcare. She's gone through all the different recommendations, got put on a list of medications, and now here she is, miserable, and we take x-rays of her cervical spine, so her neck. And you got to remember that within the neck, you should have this banana-shaped curve in the neck, a nice healthy curve, a C-shaped curve. And when we took her x-rays, her curve was actually curving in the opposite direction. Now, how in the world would that have happened? Well, 25 years of head down. You see this with dentists many times. You see this with dental hygienists. You see this with people who work at a laptop computer with their head down. You're starting to see this with kids earlier and earlier because of iPads and because of technology and because of screen time. And so what happens when we have our head down like that and our ergonomic position is now staring at our phones, looking at whatever, it's the news or we're scrolling on social media, what ends up happening is that this creates abnormal stress and pressure on the discs, on the joints, and it eventually leads to what's called degeneration or arthritis. And you say, Doc, I hear about arthritis. It runs in my family. Well, there's a lot of things that we say runs in our family, but it's not necessarily a case of just bad genetics. It's not. We know. Just Google this on a rainy day, or maybe don't use Google because of the censorship, but look this up. It's called Wolff's Law. It's uneven stress and pressure over time that will create this arthritis. It's just like alignment on your car. Alignment on your car over time will create alignment of your car over time will create uneven tires, and it'll bald and wear unevenly. And what does that create? It will create uneven wear patterns. And what do you see in the spine? You see the exact same thing happening in the spine. And for me to be able to see phase 2 arthritis or phase 2 degeneration on an x-ray like I saw on hers, that's been wearing and tearing unevenly for at least 10 to 15 years. So given the fact that this has been going on for such a long time, 10 to 15 years, obviously it doesn't correct overnight. We understand that, but we live in a society where we want the quick fix now. We want immediate relief. We want immediate solving of the problem. But we have to ask the question is, do I just want relief temporarily, or do I actually want long-term help, long-term correction where it's sustainable, where I don't live on these medications forever? Because if we just continue to just mask our symptoms continuously, what happens is it's a slippery slope where now the average American is taking 12 different medications every single year, filling 12 prescriptions every single year. That's on average. And you consider where we are right now in healthcare. If this was working, Americans, we'd be the healthiest country on the planet, but we are not. When you rank all the countries based off of health, we continue to rank dead last. Why is that? Could it be that we choose the medical intervention, we choose the quick fix, let's say, we choose to try to mask our symptoms first instead of not only looking at the cause of the problem, but finding, why is my body not healing and functioning at its best? Why is my body sending me these warning signs? And then how do I actually correct that instead of try to cover up the symptoms? And so we had the conversation, and here's the thing. When I can help somebody, I let them know that. When I can't, I'm straightforward with them, and I let them know that too. And in her case, when we saw her x-rays, she had phase 2 degeneration. She had lost all that banana-shaped curve in her neck. It was curving the wrong direction. She was degenerating at C5, C6, and C7 in her cervical spine. Those nerves are the ones that go into the shoulders and the arms and the hands. Sure enough, she's getting arm pain. She's getting numbness into her hands, into her fingers. Also, those nerves go into the heart. And sure enough, she's had many different heart surgeries. She'd had bypass surgery. She's had palpitations. And most people don't realize that the same nerves that come out of the neck are the ones that go into the heart. Most people don't realize that. And so, what I did is I had an honest conversation with her and said, hey, this is worse than what I expected to see, but we put together a plan of attack to try to help her. Now, realistically, is it ever going to look like she's 18 again? The answer to that is absolutely no. Is it going to look perfect on an x-ray? That's not the goal. The goal is to help her the best that we can possibly to get the pressure off of those nerves so that she can not only get some relief, but also train those muscles and ligaments to keep that off. And then maybe in time, as her body functions better and heals better, she can start reducing the medication. She can do that with the help of and work with the people who put them on. Listen, I don't play around with medicine. When people look at the difference between medical doctors and chiropractors, when a chiropractor spends his time, the first part of the education is mostly spent on medical education. It looks identical to a medical degree initially, and then after the first couple of years, what happens is the divide. When the medical doctors study medicine and surgeries, chiropractors, they study how to help this person with very specific adjustments. They study nutrition. They study detoxification. That's their wheelhouse. That's what they spend the time studying. And so it's not necessarily to cover up symptoms, though. We study those things because there's underlying causes that you have to get to correct those so your body can function, so it can heal at its best. And I'm always amazed with what the body is actually able to do, because sometimes I limit what the body is able to do. I see somebody who's in their late 60s and who are on a list of medications, and sometimes I'm like, all right, man, how much work are we really going to be able to do here? How much can we actually help this person? I'm always amazed. She comes back in just after a week, and she's saying, hey, I'm already feeling better. I'm already starting to extend the medication, how much I'm taking, and I'm spreading it out more. And I'm always amazed. It's like the body has this incredible ability to heal that we don't give it credit for. We don't even attempt to try many times. We don't even put in the effort to allow it to happen. So many times we jump straight into the medication, straight into the surgery, whatever it is, and we neglect the fact that the body has this innate ability to heal.